Good evening, everyone. Myself, ARSHDEEP SINGH, Assistant Professor, Meera Medical Institute of Nursing and Hospital, Abohar. So, today I'm going to explain you about the third part of the topic, that is nursing process part 3. So, let's start with the topic. Two of the parts I have already explained you about two parts. So, let's start with the third part. Okay. So, I have explained you up to the planning process. So, I'm continuing with the next part. This is part 3. So next is about the purposes of the planning. What are the various purposes? So different purposes are there, like community health needs or resolves this health problem. So first purpose is, so we plan the things in the nursing process so that we can resolve the health problem. Second one is the to match limited resources with many problems, so we can compare what type of resources we are having and how we can use them to solve different problems and to eliminate wasteful and duplicate expenditure. So this is the uh, purpose why we plan different things. Okay, next are the various types of steps of planning. So different steps of planning are there, like first step is establishing priorities. So we plan the things according to the priorities, like we have different types of resources and we have different problems for which we have to perform the planning. So we categorize the planning on the basis of the priority needs. So which of the following we will decide that which priority has to be given the first rank and second then third. Okay, so first step in case of the steps of planning is establishing priorities. So prioritization is necessary because of the limited resources available. So we will plan for that problem that is the most we can say that the necessity part. Okay, so for which we have to plan something. Okay, so that is the first step, establishing priorities. Next, second one is the establishing goals and objectives or expected outcomes. Okay, so while if we have set out the different types of priorities of the problems according to the priorities, then we will establish different goals and objectives, like what we want to achieve and how we will able to achieve the different types of objectives or the expected outcomes. Okay, so we have to set for the general goals and the specific goals. General goals, like it will be a broad statement of the purpose and it will give us that in general we have to achieve that. Okay, so that is the general goal. Establishing goals and priorities, we will set a general goal that for example we have to decrease the temperature of the person. Okay, so priority is decreasing the temperature, so that will be our general goal. Okay, so we will perform different actions related to this. Okay, general goal. So example, our example is written over here, like for example, reduction of the infant mortality rate, that is to 30 by 1000 live births. So that will be our priority and general goal. Okay, so we will perform the different activities to attain this objective. Next is specific goals or objective. Uh, in the general goal, we generally set out a single goal, but in specific goals or objective, we will specify different objectives that we want to achieve. For example, if we the example is specific objective should be clearly stated, specific, measurable, and time bound. So each and everything would be specified in that thing. For example, to reduce the MMR, IMR to 30 by 1000 live births. Okay, so it will include to register all antenatal mothers by 26 to 16 weeks of the pregnancy to prevent iron deficiency anemia, to give TT injection to all the mothers to the immunization schedule. Okay, so this is how will we attain the objective of the decreasing the IMR. So this is how we specify different types of objectives. Okay, so that is also the part of the nursing process. So these are the examples. Next, third step in planning is developing community health nursing plan. Okay, so next part is the how will we develop the community health nursing plan. So we have planned the things, we have set out the objectives, different objectives and the goals. Okay, so now we will develop the community health nursing plan, and we will plan the various types of things and resources according to the need of the patient. So we will categorize the each and every need of the patient according to the resources available. So this phase is concerned with determining appropriate nursing interventions with the community health nurse prescribed to prevent or manage the community health problems. So in this, we will manage the different types of problems, reduce the risks, and monitor health status of the community and promote the health of the community. So we will categorize the different types of nursing care plans. Okay, so like the knowledge deficit person is knowledge deficit, we have to provide the knowledge related to the specific problem. Okay, alter nutrition pattern is there. So these are the different things like the developing community nursing plan, which we have included in this. Okay, so we will plan a nursing plan with the resources available and then implement, and then we will check for the various types of outcomes that we want to achieve. Okay, next thing in this is, so the important thing in this is the various types of components that are included in the nursing care plan. So different components are there in the nursing care plan, like what a nursing plan, what is included in a nursing plan. These are different things, like first of all is the problem and the diagnosis. We will construct a problem and diagnosis, that what type of problem the patient or the person is suffering from, and then we will make a diagnosis on that. And after that, we have diagnosed the problem, we will set out the objectives, and then we will plan for the intervention, and then we will uh, uh, give the rationale that why we have planned specific intervention and what specific intervention will do in the patient's body physically. Okay, and last is we will evaluate that what we have planned and what we have get, and after that, if we are successful in evaluation, it is proven that we that or there is a result that we have achieved the objective to some extent, then our planning process is successful. Otherwise, we have to replan the things. Okay, so this is about the planning process. Next, so a format is written over here, like you can see in this picture of the table, format of the community nursing plan. You can see how we can construct the different formats. There is a format for the nursing care plan, community nursing care plan. So that is very beneficial for the students, either in any of the course. So that is a standardized format for every nursing care plan. Either it is in the community health nursing, midwifery, or other types of subjects. So what you have to write in the nursing care plan is firstly health need or problem based nursing. Problems or the nursing diagnosis is written in the first column. So second is the goals and objective. Third is the nursing intervention. Then is the rational. Then is evaluation and remarks by the supervisor. So this is the way how we plan the nursing care plan and how we write it in a specific format. Okay. For example, you can see under the health needs of the problem, statement is written over here like high incidence of the TB related to the knowledge deficit as manifested by cases reported and recorded in X village by the village health workers. So this is the type that I was discussing about, high incidence of the TB related to the knowledge deficit. Okay, so what the goal will be, early detection and treatment and prevention of TB. So why? So the persons are knowledge deficient. So early detection and treatment should be there. And why we are doing this? So as to prevent the persons from the spread of the TB. Okay, so what our objective will be to create awareness in the community about the tuberculosis disease. And next is nursing interventions. Uh, the depending upon the type of the nursing diagnosis, we will plan for the interventions like health education and counseling the group. Okay, so that we can provide the information to the community related to the specific disease, that is TB. And next, uh, about the different signs and symptoms, health education and counseling of the patient and the family members. So these are the types of the intervention that we plan for the patient who is knowledge deficient or the person who is knowledge deficient related to the specific disease. The rationale is also given over here, like it will create awareness among people while we are performing the nursing intervention. So rationale is there that we are educating the people. What will it do? It will create awareness among people about the disease and its treatment. Okay, so that will be beneficial. And what evaluation we are expecting is, or what we will get is increase in the knowledge regarding TB. So that was our objective, and that is the thing we are getting. So remarks by the supervisor at last would be there. So this is how we plan for the nursing care plan for a specific community or a specific individual. Okay, this is the format. Next is one thing is there that I want to explain is implementing community health nursing actions. Okay, so once we have planned the things, once we have set out the objectives and rationalized that, we have to implement. So implementation is a very important step. Okay, in implementation of the community health nursing actions, so uh, we have to plan the all the interventions in effective ways so that we will get the best and the we can say that the best results and the evaluation. Okay, so once the nursing interventions have been planned, they have to be implemented, that is put into action to achieve the outcomes. So we have to do these things. Okay, so in an effort or to achieve the best results, what in what form we should implement various types of interventions. These are the steps. Firstly, continuous assessment should be there and review of the problem situation through collection of the data. While you are implementing some of the interventions, okay, so you should continuously assess that process and review the problem situation, that after the implementation of some of the interventions, are you getting any type of results or that you have expected. Okay, so you have to continuously assess them. Second, do what is required to meet the need through direct intervention. Okay, so direct intervention, you have to implement the direct intervention, and what you require, you have to perform this and supplement care which the family or the community is not able to provide. So that is the second step that you have to perform. And third, get others involved in implementing care and found out learning needs of those who will be provided care, and facilitate provision of care through facilitative and developmental interventions. So you should also get the help of the other staff members and coordinate with them, so that you should get the excellent results during the evaluation. So these are the steps while that you have to keep in mind while you are implementing various types of interventions. Okay, so that is about the implementation of the community health nursing actions. Next are some of the sub points are under this point. Sorry. So it involves motivating the person or significant others to take action. Okay, so it includes decision to act depends upon whether the person or significant other considered the action to be worthwhile. So while you are performing or implementing an intervention, you have to keep in mind that if you are performing that intervention on the patient, is he or she is accepting that? If he or she will accept that, then only this intervention will be implemented in the best way. Second is mobilizing other resources. You have to mobilize all the resources that are available so that your intervention your intervention must be implemented in a proper and the perfect manner. And third, delegating responsibility. Okay, so you have to provide others the staff members the responsibility of implementing the intervention. That is, rights of delegation should be kept in mind. The right task should be provided, right person, right situation, and with right communication, you have to implement various types of interventions. Okay, so this is how we will uh, implement the interventions. Next, some of the points are there also. Analyze the training needs of the delegate and educate the clients regarding knowledge deficit, and report and record what action has been taken to monitor the progress and modify the pattern if necessary. Okay, so these are the steps you have to kept in mind. Next is the evaluation of the community health nursing services. Okay, so how will you evaluate that? What is the evaluation that you have expected? So in the beginning, we have expected some of the goals, and at last, after the intervention have been implemented, you will search out for the result that you have expected. Okay, so what is evaluation? Plan for evaluation should begin with assessment phase while planning for data collection for community identification. Then in the planning phase, while interventions are being planned, otherwise data for evaluation may not be available. So you have to check for the uh, results in short. Okay, so there is a point written over here that's evaluating nursing care. How will we evaluate the nursing care? In the community health nursing process, evaluation is the phase which is concerned with determination of what the objective sets are attained or to what extent they are attained. So this is the easy line or the meaning that I want to tell you that. Uh, so what we have attained in whole of the process of the nursing process. So what you have expected and what you are getting, so that is the meaning of the evaluation. This is the last step of the nursing process, and this is an important step because all of the things are depending upon it, and this will give you about the result that how are you planning, was your diagnostic step, and how was your uh, the how you have planned different interventions, were they right or were they wrong, or they need any type of modification. So evaluation will tell you everything. Okay, so this is the step in which we will get the results of the nursing process. Next is, what are the methods and sources of evaluation? How would you evaluate that what you were expected and what you were expecting and what you are getting? So these are some of the same techniques that we use during the data collection. First is observation. You will observe that what you want to expect and what you have uh, getting now. So observing changes in the physical condition. For example, you want to decrease the temperature of the person. If in the end it is decreasing, you will observe that that your planning is successful, or uh, alternate nutrition pattern is there, but after the implementation of the intervention, there is a balanced nutrition pattern of the patient, so you will get to know that your planning was successful. Okay, so example is written over here: be prepared to screening and observing for relevance of the services being provided. Okay, next is second is the record review. By checking different types of review records, diagnostic tests, change in health status, or immunization records of the clients. So readings, different types of readings and reporting will let you know that the health status of the patient has been improved from the past time to the present time. So if it has been in a positive manner, changed in a positive manner, then your planning of the nursing process was very good, or have been implemented in an effective manner. Next is interview or question. You can ask the question to the patient or the community members that about their condition, about their present condition, and comparing it with the past condition. So you will get the results and the valuation. Okay. Next, you can perform different types of surveys, and you can check, for example, if we are talking about the have planned the nursing diagnosis for whole of the community, then you can use this type of method, that is survey techniques. Like you want to, for example, before the implementation of the nursing process, there were a lot of cases of the tuberculosis or the malaria, for example, and after the implementing of the nursing process, there is a sustainable decrease in the we can say that there is decrease in the cases of tuberculosis or the malaria or the specific disease for which you have planned this nursing process, or if there is a decrease or we have expected a decrease and we are getting the decrease, so it is obvious that your planning process was very good and it is successful. Okay, so these are some of the ways by which you can expect or you can assess or the results, and that's the evaluation phase. Okay, so there are some of the steps in the evaluation. So these are some of the steps, and you can see in this picture. Like steps of evaluation are there. Firstly, assessing health and nursing problems. We will assess various types of problems. Then statements and goals should be decided. Then at the left of this picture, you can see deciding. Sorry, at the right, you can see that after the statement of the goals and objectives are have been set out, then we will decide outcome criteria. What you want to change, or what do you want to uh, what you are expecting, or the various objectives. What are your objectives? Then determination of the types and methods of data collection. What are the various types of data collection methods? Okay, so you will collect the data, then data collection will be there, then analysis and interpretation of that data should be there, and deciding the extent of outcome, what you want to achieve, and after that, what you have achieved, and if you have not achieved the specific objectives that you wanted to achieve, then it is the result is that your nursing process needs to be changed or modified, have to be implemented in a modified manner, because you have not achieved the set objectives. So there would be any problem in the assessment or the planning or the intervention phase. So you have to change that. Otherwise, if you are successful in getting the set objectives, then your nursing process is successful. So that is the steps of evaluation. Okay. So that was all about the process of the nursing. So I have explained you about the community health nursing process. This was the last part of this topic, community health nursing process part 3. So I have explained you about the planning, intervention, implementation, and the evaluation phase. So I have provided you the different types of notes, so you can take the screenshots and get benefit from this lecture. Okay, so that was all about the today's topic, and in the next week I will join with you with the new topics. So thank you very much everyone for your precious time, and in the next week we will meet with the new topic. Thank you very much.